Health Watch, Leeds. Inclusion for All, Action Hub. Thursday, the 21st of September, 2021. Zoom Online. Chairperson, Jonathan Phillips. Track 1. Title and Track Index. Track 2. Attendance. Track 3. Apologies. Track 4. Abbreviation list. Track 5. Welcome and improving users' feedback loop in service development. Part 1. Track 6. Improving users' feedback loop in service development. Part 2. And reflection. Track 7. Updates and future plans. Track 2. Attendance. The following are the names, job titles, and organisations of those who attended this meeting. Tatum Yip, Community Project Worker, Health Watch, Leeds. Jonathan Phillips, Board Director, Health Watch, Leeds. Christine Roche, Trustee, Leeds Society for the Deaf and Blind. Helen Rowland, Leeds Community Healthcare. Bushra Javed, Volunteer and Peer Advocacy Manager. Helen Butters, Communications and Engagement Team, Leeds CCG. Stacey Taylor, Leeds Third Sector Outbreak Plan Coordinator, Forum Central. Sutwant Wright, HARP Volunteer. Carl Proud, Project Officer, Leeds Hearing and Sight Loss Service. Heather Nelson, CEO, Black Health Initiative. Jessalyn Mahoney, Health Improvement Principal, Personalised Care. Elaine Ray, Principal Performance and QA Officer, Leeds City Council, Adults and Health. Julie Royal Evett, Strategic Health Facilitator, LYPFT. Laura Phillips, BSL Interpreter. Melissa Barker Simpson, BSL Interpreter. Track 3. Apologies. The following are the names, job titles, and organisations of those who could not attend this meeting. Alison Sherry, Interpreting Services Manager, Patient Experience Team. Andrew Barnes, Outreach Officer, Deafblind UK. Claire Nixon, Manager, Advonate. Gemma O'Connell, Administrator, Health Watch, Leeds. Hilary Adolphson, Secretary, National Federation of the Blind. Huazhu Liu, Project Worker for Sunshine in Leeds and Activity Worker for Laishi Red Chinese Seniors. John White, Lead Nurse for Patient Experience, Interpreting, Translation and Complaints, LTHT. Jez Coram, Learning Disabilities Development Worker, Forum Central. Lara Parkinson, Head of People and OD, NHS Leeds CCG. Owen Walker, Manager, Autism AIM. Rachel Koivunen, People in Action. Toshal Bhatia, Service Manager, Health for all. Wendy Cork, Development and Partnership Director, Advenet. Zaria Canham, Forum Central. Rebecca Nichols, Yorkshire Humber Care Record. Nicola Partridge, the National Deaf Children's Society. Track 4. Abbreviation list. The following is a list of abbreviations that have been used in this and previous documents. Accessible Information Standard, AIS. Health Watch Leeds, HWL. Leeds Hearing and Sight Loss Service, BID. Leeds City Council, LCC. Leeds Community Health, LCH. Leeds Teaching Hospital Trust, LTHT. Leeds and York Partnership Foundation Trust, LYPFT. National Federation of the Blind, NFB. NHS Leeds Clinical Commissioning Group, Leeds CCG. Terms of Reference, TORS. Leeds Care Record, LCR. Friends and Family Test, FFT. Leeds Society for Deaf and Blind People, LSDBP. Health Access for Refugees Programme, HARP or HARP. Track 5. Welcome and Improving Users' Feedback Loop in Service Development, Part 1. 1. Welcome, Ground Rules and Introductions. 2. Improving Users' Feedback Loop in Service Development, Part 1. Statutory Organisations Feedback. Organisation 1. Leeds Teaching Hospital NHS Trust. The following information was sent by Rosemary Horseman via email. Please describe the standard mechanism you use to enable people to feedback their experiences. Opportunities to feedback via FFT are offered to all. Available in easy read, dementia-friendly and children's formats. PALS is widely publicised throughout the Trust. How do you seek out feedback when there has been a specific change to a service beyond your usual mechanisms? PCPI team work with individual clinical teams to look at the best way to obtain feedback via our survey module, which can use extra FFT questions or stand alone, sent to patients electronically. What can people do to make it easier for people to feed their voices in particular, if they have communication needs? For deaf people, they could use PAL's text phone to pass on any feedback. Written feedback in another language can be interpreted using the Browse Aloud function hosted by LTHT. Organisation 2. Communications and Engagement Team, Leeds CCG. The following information was given by Helen Butters. Please describe the standard mechanism you use to enable people to feedback their experiences. Mechanisms they use are FFT. Feedback is taken to the Patient Experience Collaborative Meeting on a quarterly basis. Look at themes and then add anything to the action log. then forwarded to the appropriate team. Outcomes are published in reports. How do you seek out feedback when there has been a specific change to a service beyond your usual mechanisms? Communications and engagement team work on how to make services better with people who use or provide such services. What can people do to make it easier for people to feed their voices in particular if they have communication needs? Email or post for an individual to make someone aware of their individual communication needs, and then the appropriate team to provide a listening service. If they are not in a position to offer a specific service, they will work with partners or third sector. Organisation 3 leads community healthcare. The following information was given by Helen Rowland. Please describe the standard mechanism you use to enable people to feed back their experiences. Use FFT across the trust. Participation and user groups who feed back before any changes are implemented. Look at complaints monthly and trends are reported. People at every level are able to voice their experiences with the service. How do you seek out feedback when there has been a specific change to a service beyond your usual mechanisms? Always events. What should we always be doing? Work with users/CCG to develop this. Pandemic has helped to reshape how we approach feedback. Every change we make, users should be part of. What can people do to make it easier for people to feed their voices in particular if they have communication needs? Make a recorded discussion mandatory. Identified more need than ever before. Communicating with families and carers too, to make sure the patient's communication needs are known. Organisation 4 leads City Council. The following information was given by Elaine Ray, Principal Performance and QA Officer. Please describe the standard mechanism you use to enable people to feed back their experiences. Complaints are investigated and any recommendations are shared. Multiple surveys for users and carers, etc., including residential, home care, learning disabilities, and so on. Nothing AIS specific, but opportunity to feed back. You said, we did, document, published. How do you seek out feedback when there has been a specific change to a service beyond your usual mechanisms? Comprehensive consultation around big changes. Hopes that the Council would already have automatic procedures in place for those with different communication needs. Hearing loop mechanisms, large print, etc. What can people do to make it easier for people to feed their voices in particular if they have communication needs? Continue to try and meet the needs of service users. Organisation 5 LYPFT. The following information was given by Julie Royal Evett. Please describe the standard mechanism you use to enable people to feed back their experiences. Fast Feedback Tool and FFT. Accessible standard letter in easy read, sent out after an episode of care. Looking at other ways to engage service users. Patient surveys are accessible for all. How do you seek out feedback when there has been a specific change to a service beyond your usual mechanisms? Held an event for service users and their parents, and changes were discussed. Then feedback received on a one-to-one basis. What can people do to make it easier for people to feed their voices in particular if they have communication needs? Open to advice. Track 6. Improving users' feedback loop in service development. Part 2. And reflection. Improving users' feedback loop in service development. Part 2. Third sector organizations feedback. Organization leads Society for Deaf and Blind People. The following information was given by Christine Roche. What has been your experience of supporting people to give feedback and/or make complaints about health and care services, especially if they have communication needs? Opportunities for feedback are as open as it can be. Send in written feedback, survey responses, face-to-face, phone calls, video messages, open meetings with BSL interpreters. How do you support statutory organisations to get feedback from people, in particular those who traditionally don't like to give their views? Organise meetings for different organisations so people can go and give feedback. Making training videos for hospitals and their staff in order to benefit service users. Created a buddy system where service users can access an iPad and contact a member of the team so they feel less alone. Do you have any suggestions for making it easier for people to feed their voices in? Go directly to trustees. Leave video messages. Use social media for engagement and/or feedback. Carl Proud, BID. Problems with sending out letters. If a service user receives a letter but requires it in a different format, they might not receive the alternate format in time, if at all. Barriers really put off people giving feedback. Heather Nelson, Black Health Initiative. One-size-fits-all approach is still very much an issue. Statutory sectors should be working with third sector partners more, building up trust between providers and diverse communities. 3. Reflection. Jonathan Phillips. How much sharing of good ideas is there? Worth exploring. What can we do to increase the level of trust and to make people feel more confident that what they say is going to be heard and acted on? Bushra Javed. Service providers could engage with communities and their already trusted third sector teams. This may help to build trust. Tatum Yip. HWL has gathered good practice and circulated these to the key representatives of statutory organisations so they can replicate. Echo the idea that service providers should work more with third sector organisations. Helen Rowland. Good practice is shared, but there could be a better way to go about it. Track 7. Updates and future plans. 4. Updates. Tatum Yip. 4.1. Yorkshire and Humber Care Record and Leeds Care Record. We have been trying to find out whether a central data system such as YHCR or Leeds Care Record can enable people's communication needs to be flagged and shared across all systems in the city and beyond. So far, we have been informed an action was agreed to appoint an accessibility lead for Leeds that would take on this development earlier this year. However, no one knows if someone has been appointed to this role. Comments made about how this needs to be escalated to a strategic team who have more influence. Leeds Care Record agreed to make the patient reasonable adjustment document available for all service providers to access. 4.2. Using people's experiences to influence AIS agenda, locally and nationally. We have started to influence primary care on AIS implementation based on the intelligence we gathered. Example: presenting what people told us in an inequality session with the clinical directors at Primary Care Network. Carl Proud of Leeds Hearing and Sight Loss Service was invited to present the insights. A similar session will be replicated for practice managers. This evidence will also be fed into a national campaign about AIS implementation initiated by Healthwatch England. BID and Leeds Society for the Deaf and Blind People are linked into British Sign Language Rapid Review of Interpreting Service, developing a best practice guide for UK commissioners and providers. Future plans / next meeting. Date to be confirmed. Focus on how we can embed AIS in primary care. Update on National AIS campaign. Update on the BSL Rapid Review work of interpreting service. Work on improving feedback and addressing barriers. Mistrust issue.